Good afternoon, everybody. So I think it's time to start. So first of all, I would like to thank the network for inviting me moderating the session. So as you already probably know, this is the fourth session of this international conference organized by the Shared Patient Experience Network. And you will find the videos of the presentation available on their website. So before we start, let me first quickly introduce myself. So my name is Anne-Sophie Grel. I work at the Hospital Clinic of Barcelona in the Living Lab unit, both as a project manager and a researcher. So in summary, our main mission in our unit is to evaluate the patient experience in order to understand unmet needs of our patients and also caregivers in order to improve the quality of healthcare. But we also do other things such as, for example, participatory health research projects. We try to incorporate the voices of the patient, caregivers, and citizens at large within our health research project. So actually, our speaker today will be presenting one project that we have coordinated and in which they have been an important and key partners. The project is called CALMA. So today with us, we have Lakshmi Parameshwaran. I am sorry for the bad pronunciation of
it's
your
very
last
good.
name.
It's fine. It's good.
Thanks. And well, we'll all call her Lesh. So that's why it was so hard for me to pronounce your last name because I always call you Lesh, right? So thank you for being here with us today. So let me introduce a bit yourself. So you are a designer and you've been working in the area of health and care for more than 2 decades. In 2008, together with Laszlo Erzeg, you co-founded Fuel4, a specialist design consultancy working with a wide variety of international players within the health and care sectors. In 2017, you have also co-founded the Care Lab, a collaborative platform that uses human-centered design practices to rethink and redesign care models and solutions for our society and care system. So the vision of the Care Lab is care that is equitable, proactive, compassionate experience, that is widely accessible and that form an integral part of everyday life from birth to death. Previously, you were Innovation Director of the Global Healthcare team at Philips Design. You hold a Master of Engineering degree from Cambridge University and a Master of Arts from the Royal College of Art in London. So today, Lesh, you will be giving a talk that is titled A Call to Redesign Care Back into Society, Strategies for Creating Equitable, Proactive and Compassionate Experiences for All. So you will be presenting probably until 5 p.m. and then we will have more time for debate with our participants. So now that we know a bit more about both of us, we will ask some information from our participants. So we would like to know a bit more about you, since we don't see you, but we know that you are connected. So you will see a window that will open in your computer. If you can respond to the poll, it's very short, but we would love to know in which position you're working, which country you're based, and if you have worked previously with designers or design seeking in the past. So maybe we can wait for 2 minutes for the participant to fill in the pool, and then Lesh, the floor will be yours. And probably I will just, remind you the time when it's almost 5 so that we can keep time for the debate. So Lesh, I think you can read the results. So we have mostly participants from management administration and the research field, from Belgium, France, other country, from the EU and out the EU. And mostly 88% of those participants have not been working with designers or design thinking methods in the past. So I guess your presentation will be insightful for them. So Lesh, the floor is yours.
Thank you, Anne-Sophie, and good afternoon, everyone. I can, as Anne-Sophie said, we see 15 people online. I don't see your faces, but I know you're there. Thank you for the poll, because that gives me a little bit a sense of who you are and where you're sitting, and maybe what's more interesting for me to share in my presentation. I'm going to share screen. Let's see. Okay, so I hope you can see this. So as Anne-Sophie said in her introduction, I'm a designer. I have been working in the area of health and care for a number of years, and I'm really excited to be invited here. I have to thank Dr. Joan Escarabil for inviting me, and to Anaïs from SPX for working together to organize this presentation, and of course to Anne-Sophie for being together in this conversation with me. So I would like to talk about this idea of putting out a call to action, a call around redesigning care back into our societies. I'm going to have a presentation in two parts. So the first section, I would like to introduce to you what it means to take a design approach in healthcare innovation. And then we thought it would be nice to stop and to take a few questions or any comments. So we'll pause and we'll have some Q&A time. And then I will continue a second part with some examples of 4 different strategies for putting care back into our systems of care. Okay, so as I'm presenting, please use the chat, make any notes and comments. I really love the debate part of these events and to hear from you. So I encourage you to participate. So these are some of the areas of health and care that we've been working in over those many years. You see a lot of different lines or services. I always think of this as having had the opportunity to work on everything from birth to death and all of the stops in between. But over the years, what we found as we worked on service innovation and different kinds of product and technology innovation projects in these areas is that the most interesting insights, needs, and opportunities often lay in the spaces in between these dots. And so a few years ago, we decided to reframe our practice and focus on care. So care is transversal. Care is a way of thinking about our experiences of health and care that cuts across sectors. So it cuts across healthcare, social care, and education. Care is also a way of framing the opportunity space to really have more systemic impact. And importantly, care is a quality of experience. And in this way, we really try to stay close to representing the human experience of health. So how do we define care at the Care Lab? We see care is made up of compassionate actions. Here is nice to think about some small examples from everyday life and that some of you could probably relate to. I know I can. So care is, for example, a mother or a father waking up in the middle of the night to warm up milk for their child. Care can be helping an elderly couple carrying their shopping bags across the street. Care can be a teacher writing a note to a student to congratulate them on achieving a milestone or reaching a goal that they were working towards. So care is made up of these small, kind actions between human beings. And yet, when we deliver care, currently, most of our systems and processes and services are running in a way like we manufacture cars. So this is a very provocative statement, I know, but for many of you I see are in administration and in management in healthcare systems in different countries. What I'm talking about here is the focus on cost efficiency, the focus on streamlining, which is absolutely important, of course, but we're losing those qualities of care that I just described in the way in which we deliver care. So as we reflected on those years of work in healthcare and reframing around care, it was also a realization that we are not design consultants, but we realized that we are actually care activists. This was a much clearer role that we could resonate with, and we happen to be designers. And I have to say that in the last few years, as we've been practicing as the Care Lab, we have met other care activists who are coming from various fields. I've met doctors and nurses who are care activists, patients. I've met civic leaders, people working in governments who are care activists. So the most important thing is what we're working for. And of course, bringing in my case, our design capabilities and skills to the table to contribute. So at the Care Lab, we work in a proactive way. As activists, we have to stand for something. So we believe that there are 7 intervention areas where, as design and designers, we can play a role to transform our world of care. And I want to introduce this framework, this action framework that we use within our practice, and describe for you these 7 areas. So in the center is really the meeting point where patients and caregivers meet with care professionals. Could also be where students meet with teachers, but for this particular event, I think we're thinking about healthcare, we're thinking about care professionals and patients. And one of the areas of action, and I will be showing you some examples of this, is around normalizing just the basic conversation around care that happens between a patient and a professional. Also in the sweet spot here are opportunities for really designing care together. And I think SPX's mission and focus is ideal, that we can talk about participatory methods. And I'll be sharing with you how design practices can help to support co-creation of services between patients and citizens, caregivers, and professionals. When you zoom out to the right, you start to look at how can we impact the way in which ordinary people engage with care in their day-to-day lives. So what is it that can engage someone to change to a healthier lifestyle, or to develop a new habit, or to incorporate preventative health measures into their routines? Zooming out further to the right, we place that in the community setting. What if we could really place care in a way that fits into people's everyday lives? And I'll be showing you some examples of what that could look like. Maybe what's more interesting for you guys as an audience, on the left, we start to look at how we might impact the way in which our care professionals are trained and actually empower a new breed of professionals who care. What I mean by this is professionals, nurses, doctors, medical social workers, psychologists who together as a team are developing the skills to have careful conversations, to be able to support participatory and shared decision-making, for example, and who can engage in co-creation with patients and with caregivers. But that new breed of professional need to also be supported by the organizations that wrap around them. So one line of action that we are working on is nurturing caring environments and organizations. So this could be working, for example, here in Barcelona with Hospital Clínic since a number of years on various programs and projects to actually bring in this way of thinking, this mindset, and this approach to transforming care and transforming the culture of care within the organization. And then on the topmost level, and it wraps all the way around this picture, is more the impact on policy and society. Because as we shift these different interactions and as we introduce new kinds of solutions and strategies into the world, we're also changing the landscape. And one of the areas that we're passionate about is actually breaking down societal taboos that exist around care. Now, this may be around mental health, it could be around sexuality, it could be around diversity and inclusion, could also be around topics such as end of life, which I will be sharing some examples as well for you. Now, what is a design thinking approach? And I saw from the poll that some of you are familiar with this methodology, which is great. And for those of you for whom it's new, design thinking is a human-centered approach to innovation. And it is being used across multiple sectors, but also in the healthcare sector. And the principles of it are very simple. The applications can be complex, and that's what makes it fun and rewarding. But we always start with the first step of understanding the issues and needs of the different people involved in any given healthcare context. So we step into their shoes, and through qualitative design research and ethnography, we walk with them to understand what it is they experience. It could be a diabetes patient, it could be an endocrinologist, it could be a social worker, it could be a family caregiver. Let's try and understand what it is that they need along different care journeys that they are inside. With that understanding, we go into a create phase. So imagine that you have information, but also a lot of inspiration from the stories that you gather through the understanding step, and you use those to create new care experiences. Now, experiences often take place over time, and they involve different people, different settings. So we really try and think holistically about where those needs can be addressed and in what new ways. And an important element of design thinking is the fact that it is messy and complicated. And yet with this framework, what we can do is we can try things out very early in the development process and go into a testing phase where we build prototypes, which are like mock-ups, and you're going to see a few of those in the case studies that I will share. We test those prototypes back out there in the real world, and we do that early enough that we can learn from the feedback and we can iterate. So you see the gray line loops us back, because as we test the prototypes, we deepen our understanding. As we deepen our understanding, we come up with new ways to refine and evolve those solutions. And in this way, design thinking gives us a very powerful mechanism for moving from an insight to a final implemented solution. So I want to pose this question. I'd like you to think about this with me, and I will show you some ways that we're responding to it. This is a question that we're very busy with and focused on within the Care Lab. How might we design care back into our systems of care? So what I described in the beginning, the danger that we're kind of squeezing out, streamlining away some of the qualities that are important for delivering compassionate, equitable, and proactive care. So how might we actually design those qualities back into our systems and services? And I want to share with you about 4 different strategies. Try to pick up strategies that I think are kind of on the fringes of healthcare. They're a little bit in our blind spots, I would say, and illustrate those through some examples of projects that we are doing and have done in different countries and systems and with different communities of patients and care teams. So this first blind spot that often exists in healthcare is to think about caring for caregivers. So many times services are focused on the patient or on the client. And this was a project that we did with the National Council of Social Service in Singapore in 2016. And they asked us to think about the experience of caregiving. So we were looking at caregivers, family caregivers, sometimes called informal caregivers, who are often under-supported. They are invisible sometimes within our systems and services, and they are the ones that are journeying with patients throughout the different healthcare touch points along a journey. So this project was to deep dive and understand their experience in order to come up with solutions and strategies to support them. So one of the main insights from the research that we did, we worked with 10 different families in Singapore. I need to mention that design thinking and design research is qualitative, so we are not talking about large volumes of people involved in the research step. But what's important is finding those, in this project, particular profiles of families where there was a complexity in the caregiving. For example, a lady who is looking after both a disabled son as well as an elderly aging mother with dementia. So she has a double caregiving burden. This was one of the stories. But the key insight and the image that you see is the fact that the caregiver is actually the red thread between different social and healthcare services and touch points. So they are the ones that journey with the patient or client and cross over the different sectors. So it was important to understand them and to gain insight into what are their issues and needs. In this project, we spent time, as I said, with 10 families and came up with the 7 emotions of caregiving and created 7 insight films. So this is a way to bring understanding to life and to make it shareable. And these are short films that pick up on the different emotions from tiredness and fear, and edit together some of the footage from the visits that we did to different families to understand their context in which they're living, to accompany them on their day-to-day activities and routines, and sometimes even their health or social care appointments. And we put together these films as a trigger to inspire and inform different stakeholders within the sector in Singapore to come up and co-create new solutions. So this is just one format of output when we do insights research. This material was taken into design sessions where we started to visualize and create ideas for new types of solutions and services. And what you're looking at are 4 images from actually 3 different sessions that we ran of co-creation. On the bottom left is a group made up of key decision makers and managers coming from across different sectors who can influence the strategy and the direction of service development in Singapore. And this was a particular session to get their feedback, input, and ideas around the solutions to support caregiving. On the top left, we have some of the frontline teams that are working with caregivers in the social care sector. So these are social workers and therapists and center managers, for example, or nursing assistants. On the top right is a session with caregivers. Actually, we visited them in their homes, and we also invited them to a group co-creation session so that they could shape the ideas and add to those ideas as well. And these rounds of co-creation really, 2 things. They create ownership amongst the end users and the stakeholders within the system for these solutions around caregiving, but they also enrich and are a reality check in terms of the kinds of ideas for new services that would make sense and would have meaning for people. So the outputs of these projects are quite varied. I won't go in detail on all. I just want to pull out, you see that there are some digital solutions and tools, as well as some more analog solutions as well. On the top right, we created a toolkit for social workers to be able to work with caregivers and support them. So currently their tools and their training is focused on the client, and we developed this toolkit, which was then translated into different languages to work with different communities and rolled out in Singapore. And then on the left, you have a concept called Care Exchange, which is a community care platform, a digital platform that would allow people within the local community to offer as well as receive support in everyday tasks. For example, a hand to transport someone, to get a lift or a ride to an appointment, or to exchange some household items, or to pick up shopping. So very practical support. And maybe interesting for many of you, because we're talking within the healthcare system, the bottom image is the Blue Flag Protocol, which is a referral protocol that enables healthcare professionals in the healthcare system to hand over to social care professionals in order to accompany caregivers as their loved ones transition from one set of services to another. Anne-Sophie mentioned a project that we've been doing together with a hospital clinic and the Living Lab here. And I connected to the work that we've done in Singapore, because this project, which is an EIT Health project, was looking at COPD and the symptom of dyspnea. The project is called Calma. And in this project, we are looking at how to help patients, but also their caregivers, manage the symptoms of dyspnea in day-to-day life and be able to cope with crises when they happen and to recover from a dyspnea crisis. So on the bottom left, you see the Calma program, which is really looking at how to equip care pairs, we call them, caregivers and patients, to equip them with the skills, the knowledge, the confidence to be able to manage these crises. And if they experience a crisis, to actually recover and get back their health routines following. So we've been developing a number of tools and a curriculum and a training program. You see some of the tools on the bottom right. And this has been done, of course, in co-creation workshops here in the Living Lab. The image on the top left is working together with these care pairs here in Barcelona, but with this project, we're also working in Portugal and in Poland. So with each of these examples, I have to say, we learn so much with every project, and the strategies, for example, here working with caregivers, we always end up with new questions and new challenges that we still have not been able to crack. And so I wanted to pose these to you and to share them with you, because one of the questions that we still have around this piece of work is, how do we really design with intent to achieve lasting structural change? So we can come up with various systemic solutions and strategies, but how do they get embedded, for example, in policy level or within a system level? And how can we consciously design those solutions to achieve that kind of structural change? And that's something that we're learning about constantly in all of the projects. The next strategy really relates to what I was talking about in terms of transforming our cultures of care within different organizations. So designing care organizations. And here I want to bring an example of a project, again in Singapore, where we were asked in 2013 to reimagine the experience of inpatient hospice care. So this is patients with up to 6 months left to live. And we were asked to rethink the model of care for these types of hospices in Singapore. And at the time, there were 3 hospices that were at the point of moving to a new facility, and they had this chance to rethink and redesign their service. So we developed a service handbook you see on the left. The project was called Hospitable Hospice, and it included 24 experience design principles developed from spending time and doing research with different families and patients and care teams in these hospices, and coming up with one of the examples here on the right is a new building model for how to conceptually create these different spaces for end-of-life care, thinking about areas that are social, areas that are private, areas that can adapt as people's illness progresses and they become closer to the end of life. There are 3 hospices that were built as a result of this work. St. Joseph's that you see here is one of them. And one of the really incredible aspects of this project and this team is that they have a very strong vision about the idea of a circle of life. So this is a religious organization. It's a group of Catholic nuns. And you see that they have their chapel on the right. This is the original chapel. And around that, they built the new nursing home and hospice. But in the center, you can see a kindergarten. So they actually have a childcare facility within the hospice. And this is open to the neighborhood and for children to actually engage with elderly and to experience all stages of life and to normalize what it means to grow old and to develop relationships also across generations. The reason I picked this one to illustrate this idea of designing organizations that care is because a year after we finished the project, about a year after the hospices were built, we were able to go back and visit one of the teams. And this is an image from that visit where we walked into the dining area of the staff. And this is one of the clinicians working in a dementia ward. And she didn't know that we were designers. Singapore had, since a number of years, been introducing design thinking into the healthcare system as a whole and training care teams in the methodology. And we noticed on the wall of this cafeteria area a poster that had been drawn that she's showing here. And we asked about it, and she explained that as a care team, they're constantly looking to see how can they improve the experience for the patient. And this was a sketch of the journey from admission, referral and admission into their care. And they were trying to map out the patient experience journey and identify opportunities for them to improve their service. So when something like this happens, I think this is the ultimate goal, is that we design ourselves out from the system. In order to do so, that culture of innovation, that mindset of thinking of patient experience, but also the skills to continually innovate are placed within the organization, and therefore it's a much more sustainable kind of impact that you can bring. And this is another slide that I want to share from the Patient Revolution. Some of you may have heard of the Patient Revolution. It's an organization in the US. It's been spun out from the Mayo Clinic with Dr. Victor Montori and a designer called Maggie Breslin. And last year they invited us to join the Patient Revolution Fellows program. And this year we've been working together with a whole host of fellows from not only designers, but a lot of administrators and clinicians and professionals to demonstrate a new model of primary care. And so the idea is the Patient Revolution Clinic will be opening in the US later this year. And it will literally demonstrate this new model of primary care that is community-based and community-driven. And they're really rethinking, we get to design every aspect of this clinic model, including the profiles of the care team and the staff, the way in which scheduling will happen, the way in which visits take place, and also the organizational structure and culture, as well as processes and engagement with the community. So when it is one of the challenges we face is in trying to innovate within current healthcare systems, within the boundaries and constraints. This project is a unique opportunity to create a new model, kind of independent of the system that Patient Revolution believes is a heavily industrialized system, especially in the US, and to create this new model and to also gather data around the impact of delivering care in this new way. So it will be a learning organization. It will be open to other teams wanting to learn how to do this, and hopefully at some point to be able to bring that model to different countries. And we're really privileged and excited to be involved in this incredible experiment. So what helps a new culture and model of care really thrive and sustain? This also is a question that we are constantly aware of and trying to figure out through the different projects and programs that we're involved in. This third strategy is to really drill in. If you remember, I showed the framework for the care lab. Right in the center, we talked about normalizing care conversations. And so this next example is about how we might design these care conversations. And I want to show you a particular conversation toolkit that is called Bite-Sized Future, and it's been designed to facilitate a conversation around end-of-life wishes to support end-of-life care. And the important thing with this solution is that one of the insights we had is that there never really feels like a right moment to bring up this topic with a patient or with a family. It's not something that people want to talk about. For example, when entering a nursing home with a loved one, it's at the back of your mind, but it isn't something that is easy to share within the family or even with the care team. So what we did was we created this as an experience and an invitation for families to come for an afternoon tea. So we create a little event, a moment to stop, to sit together, to share some food and some drink, and to bring up the topic of end-of-life choices. So we really try to reframe the tone of voice around this conversation. And now I'm getting hungry watching these cookies, but the idea is that with each cookie comes a card. And on those cards, together with the palliative care team, we developed a number of questions. At the front of the tray, the questions are a little bit easier to get started. And the facilitator, which could be a nurse or a social worker, can guide the family through picking a cookie, picking a question, and starting to look at what matters for them in terms of what are their fears and concerns, what are their wishes, what kind of plans might they want to make for the future, what's important for them, what matters at the end of life. So the development of this particular conversation toolkit, this is the team from St. Joseph's Nursing Home that I showed earlier. And this is one of the prototypes of this toolkit that we are, like I said, with the design thinking methodology, we can make here with a quick cardboard prototype with the cards, with the cookies, and we can role play and they can try this out. And what was very memorable from this particular prototype test session is the team told us that somehow the physicality of the box, the tray, the cookies, and the way that they could sit all together, it gave a certain dignity and calm and preciousness to the time that they could spend. So it actually created that safe space in which this conversation could happen. And then the tools prompt and trigger the conversation to start. And then, of course, it can be facilitated and flow. But here is where I think design has a role to play in making tangible some of these different props and tools that can trigger certain behaviors and emotions and reactions, and to guide that towards creating a more compassionate service. So how do we reset expectations around the care conversation for patients and professionals? Because we talk a lot about equitable care and we talk about wanting to have participatory healthcare practices. So really hearing the patient's voice and really meeting with a professional to decide together upon their choices and preferences and what fits. But I think we have to recognize that not all patients are ready for this and not all professionals are ready for this. And I would love some debate and questions from you guys, whether you see it this way too, and what are some of the challenges. Because I think as we offer these more equitable solutions, we also have to bring everyone along and to make this something that a direction that we can all engage with, whether it's patients or different types of care professional. This is a final strategy, and it's really on the right-hand side of our action framework where I was talking about how do we place care into the community, because we live in communities. We don't live in hospitals. We live in communities, and the community context is important to understand, to see how the community can actually support people in different types of care needs that they might have. So this is from a project that we began just before the pandemic, and we were also working on it through last year with Barcelona City Council. Some of you may have heard of an urban strategy that grew up here in Barcelona more than 10 years ago called the Superblocks, the Superillas. And it began, on the left-hand side, you see an image. It began with really thinking about how to create greener, cleaner cities, and was looking at the issues of air pollution and noise pollution. And the city began to create these grids where they could divert traffic to create more green spaces within these urban grids, and also to promote biking and to promote walking and to clean up the air in these neighborhoods, but also start to think about different services that could be within walking distance. So that was the original intent. And then the social rights department of the city council began to think about these grids and this urban kind of strategy and layout to say, how can we use this to optimize the way in which social care is delivered within these neighborhoods? So they started to organize their home care teams around this grid model, and to give a dedicated autonomous teams of social care professionals the ability to serve that neighborhood, that community, in order to nurture those care relationships, and also to deliver more personalized and optimized care. So we started to work with them as they were exploring how could they build on top of this and think about an aging strategy for Barcelona, and how could they consider the care superblocks and what would that entail. So I want to just play a clip from this video, which is a project that has been running for more than 10 years here in Barcelona called Radars, or Radars. And it was a project that was born out of the community. So there's a neighborhood in Barcelona, for those of you who have been here, called Gracia. And this neighborhood is very intimate and connected, and the qualities of care that I've been talking about are very present. You'll feel it when you go into this neighborhood. So it was a very natural step, I think, for a project like this to emerge from this community. And what Radars does is that it sets up community stakeholders, people within the local community, to act as radars or detectors. And they are able to identify elderly who may be suffering from unwanted loneliness. Now, the reason that it works on a neighborhood scale, you see the elderly lady here, like many elderly people in this neighborhood and across Barcelona, they have their daily routines. They go to the same butcher's shop. They go to the same cafe to take their coffee. It is these shopkeepers and shop owners who get to build the relationships with them, and that notice when they perhaps don't show up. And so what the service does is that they train these members of the community to act as early detectors, to be able to put in touch with social care professionals to reach out to them. This whole service is driven by volunteers from the neighborhood who come together in their free time to man the call center that is following up and checking in on people. And this was such a successful community-based model of care that it has now spread to different parts of the city and also to other cities. And it's an inspirational project also for other countries and systems. So, for example, in Singapore, the team from the Ministry of Health visited Barcelona, and we organized them to be able to see this service, meet some of the people, go down onto the streets and actually see how it works on the ground. And it's something that they're looking at how to bring that back into some of the Singapore neighborhoods that they are working to transform. So this is a great example of considering care on a community scale. And we took those best practices and started to work with a community in another neighborhood called San Antoni, where they also have a superblock, and to work with, this is a workshop with some of the local residents to understand their issues and needs when it comes to aging within that environment. How might they best be supported, not only by services, but also by the design of new kinds of public spaces? So we were looking at the layout of this neighborhood, and we were trying to see how could we develop a strategy and a set of service solutions that could enable them to age in place, particularly by connecting them with young people living within the neighborhood, and to enable them to build relationships across generations and identify ways to support one another and actually become a kind of care force at a neighborhood scale. We went on to take this topic and open it up for debate. And this is a webinar that we ran at the end of last year. And we found that there are similar stories, similar models, really amazing services and strategies being piloted and tested in different countries and cities. So we linked up with the UK through Hilary Cottam, but also back to Singapore and Rotterdam and Trieste in Italy. And so this topic of nurturing care in communities, especially post-pandemic, is something that is extremely relevant and very valid. And I wanted to bring it to all of you because I believe that this space beyond healthcare is an opportunity area for us to think what new partnerships are needed to place care really at the heart of communities.
Lesh, I don't want to interrupt you, but just maybe...
My last slide.
Yeah, okay, great. Thanks.
We're good. So yeah, just to say, I would love to hear from all of you now. And if anyone also would like to, feel free to get involved somehow. We're open to share stories, to partner up. We have been going to find European funding around some of these topics right now together with partners, because it's something that the EU is driving forward on looking at new ways to live, especially post-pandemic. So I would love to hear from anyone and any organization that might have an interest on the topic of care. Yeah, would be wonderful.